The fight against coronavirus now. The FDA Advisory Committee is meeting to discuss Johnson & Johnson booster shots just one day after recommending Moderna boosters for millions of Americans. Whit Johnson has more for us on that.
Today, a key FDA panel is set to review Johnson & Johnson booster shots and discuss the effectiveness of mixing and matching vaccines. This after that same advisory panel voted Thursday to recommend Moderna boosters for millions of Americans.
We do have a unanimous 19 out of 19 yes votes, and that concludes the voting portion.
The group includes anyone 65 and older, 18 and older with underlying health conditions, and those at high risk of exposure to the virus at work. Studies show the Moderna vaccine has remained highly effective against severe illness and hospitalization, but waning slightly when it comes to protecting against those more mild breakthroughs. The company saying its booster will only require a half dose to restore protection.
What we're trying to do is bring your immunity up to the point when you were first vaccinated, and essentially these boosters will do that trick.
The FDA and CDC still need to sign off on Moderna boosters, which could come by late next week. But with 66 million eligible Americans still unvaccinated, battles over vaccine mandates heating up. State officials in Maine warning fired healthcare workers who refuse to get vaccinated won't be eligible for unemployment benefits. And in Chicago, the city preparing to stop pay for police officers who failed to report their vaccination status by today. Officials are also expected to make a decision about the Pfizer vaccine for kids ages 5 to 11 by early November. But the Biden administration is already telling states to begin pre-ordering doses next week to prepare. Kira?
Whit Johnson, thank you so much. Let's talk more about this, shall we? Dr. Darien Sutton joining me now for more on all this booster shot news. Darien, great to see you this morning.
Good to see you too, Kira.
All right, well, when will the rollout for those eligible for the Moderna booster begin? And how do you think that's going to help us in this fight against COVID as we're moving forward?
So I think that the rollout will probably start sometime after next week. So as was stated, the FDA voted to approve the Moderna booster shot for those who are over the age of 65 and those who are high risk or highly exposed. So now as physicians, we wait for the CDC to make clinical recommendations to roll them out to the community. The main goal, and I want to make sure that this is clear, is to help protect those who are high risk, as those who have received a primary vaccination still have substantial protection against hospitalization and death from COVID-19. And so, again, we're just focusing on those who are high risk and those who are highly exposed.
And, you know, the FDA has been, we covered this yesterday, the FDA is continuing to have this ongoing meeting. And this time, they're going to be talking about a recommendation for J&J booster shots, as well as mixing and matching. So what are you looking for out of this discussion?
So today's discussion, I'm really excited for it because it's going to be a healthy discussion between these 19 career scientists and immunologists regarding the benefits of the Johnson & Johnson booster, as many of my patients have been asking me this very same question. It's unfortunate, however, that today will only include a discussion regarding mixing and matching, as they will not have a formal vote on that. And there's a couple of reasons why. One is because of protocol, and the other is because of data. Although we have new data from the NIH that supports that mixing and matching is beneficial, we have not yet had the full substantial amount of data that people would deem effective or necessary in order to make clinical decisions. So we'll have that discussion, but unfortunately, we won't yet see a vote on that.
All right, well, we'll keep following that for sure, because I know there's a lot of interest in that. And also, booster shots, they're great to keep everyone safe, right? 66 million eligible Americans are still unvaccinated, though. So how does that number affect what we're going to see this winter, you think?
That is the most important question, as although we can have this discussion about boosters, we can't distract from the primary cause of infection, transmission, and outbreaks here in the United States. As we know that those who are unvaccinated are 5 times more likely to be infected and therefore more likely to transmit from one person to another. As we move into these colder climates and people move indoors, we have to really be cognizant and take a level of caution, because although numbers are trending down, COVID-19 has not left sight. And so we cannot let our fatigue and our pandemic fatigue allow COVID-19 an opportunity, and that means taking precautions, making sure that you're in spaces with ventilation, wearing masks around those who are not vaccinated, and even involving surveillance testing.
Okay, as parents, very important question here, of course. Halloween just around the corner. The kids are asking about trick-or-treating. What do you think? Is it okay, since it's outdoors, even those kids, even for those kids under 11 that are not eligible for the vaccine yet?
I think it is okay. A lot of parents are asking me this very same question. Outdoors has been and still is a very relatively low-risk activity, and I think it's completely okay for kids to participate in activities outdoors for Halloween trick-or-treating. One of the main things that you should do is that if you want to protect your child the most, it's making sure that the household that child is in, all of those who are eligible to get vaccinated, gets vaccinated, as we know that children are more likely to get infected from teenagers and adults. And I think that if you have a situation where your child is in communication or close contact with other children from households where you're not sure of their vaccine status, maybe you should think to involve a mask as a part of their costume.
Dr. Darien Sutton, thank you so much. Appreciate it.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.